So we're over in the medical school area now. This is the Dell Medical Center. I think what I read is that it was one of the first from the ground up newly built medical schools at a major research institution in the last 50 years. So this is a really big deal. It was underwritten in large part by the Dell Foundation. So we know that sort of innovative health technology is baked into all of this. And so it includes a medical school which only accepts 50 students per year out of 5,000 applicants. So it's highly selective, a very small program, and they are looking for sort of leaders in this new innovative health space. And then it's the hospital system behind us is connected also through the Ascension network, which is a Catholic affiliated medical system, which is a very old system, although the facility is new. It dates to 2016. But it's Catholic affiliated and affiliated with Dell. And what we just found out when we were walking up here is they, couple of years ago, they had made arrangements for the hospital to share all of the medical records with Google so that Google could use it for AI. So part of the reason that we're here, when we were at the McCombs Business School, there was an initiative around health innovation. There is a lot around health transformation, which we know is about the Internet of Bodies and ultimately transhumanism, cybernetics, centaur, augmented human bodies. And that's going to come through your electronic health records, and that's going to come through the digital twins. We also know that in this sort of post-COVID, navigating COVID era, that the medical passports and blockchain will likely also meld with these electronic health records. And it's very interesting because several years prior, around 2018, there was an initiative here in Austin called MyPass. It was tied to ID 2020, which is one of these larger global digital identity initiatives. Austin was a pilot city, and this money for this program came from Bloomberg Philanthropies. And of course, we know Michael Bloomberg is very much about data-driven government and smart policing and predictive analytics and big data. And then it was also funded by the Roberts Woods Johnson Foundation. So this program called MyPass, essentially, and if you understand this within the context of geofencing, apartheid, the border at Gaza, the idea of the slave passes, a pass system, but it's being sold as convenience for unhoused people here in Austin who would have their biometrics taken and added into a database, and then their identity system would essentially be put on a laminated QR code on cardboard and given back to them. So these people might not even have a smartphone to access a digital identity, but the cover was that their health records would be then put on blockchain, and so that they would have ready access for coming into the emergency room, which is clearly health is a huge issue for the unhoused population. But that is going to be a market for impact investing, especially tied to preventative health and social determinants of health. So the social impacts finance space, which the GSG conference is all about, is very much linked into social determinants of health, and many of the health systems and the insurance companies are actually making these investments in the housing, the food, the exercise, all of these programs that are going on. But the question is, what is the agency of the individuals who are caught up in these systems tied onto blockchain? Is it for their convenience, or is it for their behavior management? Also SNAP, the programmable food assistance benefits. And that's really important because the Dell Foundation, which is the Dell money, I don't know that they're directly interfacing, but they're definitely the same pots of money, are looking at social determinants of health and preventative care. And so again, it is interfacing with the health system and health innovation, which comes with a lot of surveillance that we are living in this larger biosurveillance protocol. So this is why we're here. I think we want to draw attention to the MyPass program, especially within the context of medical apartheid that is coming online now, and patient compliance tracking. And so I'm just going to go over to the medical school building here, the health learning building, and take a little bit of dandelions and then move on to our next spot. Transmute. MyPass, transmute.